Hey, everybody. Happy Friday. Today is Friday, October 17th. It is 11 a.m. on the West Coast and it's 2 p.m. here on the East Coast. I hope you all are having a great Friday. I am Julie Barrett, founder of Conservative Ladies of America, and I wanted to do this live stream on this information because it needed to get out right away, and it's actually easier to do these things live. But I also wanted to do it live because I wanted to chat with you guys if you have questions or comments about this. Wanted to be able to chat with you about that and try to answer as many questions as I can. So we are streaming live on Facebook, on the Conservative Ladies of Washington Facebook page, because this is really going to impact our Washington audience pretty dramatically. And I'm on X, on my personal X account. So if you're joining me there, wherever you're joining from, we're on YouTube too. So wherever you are watching from, chime in, say hi, let us know that you're here. Would love to also know where you're watching from. So let us know in the comments that you're here and where you're watching from. That would be great. We've got Mary Long in the comments on YouTube. She is on our leadership team. She primarily deals with kind of her main area of focus. We all overlap. We all do pretty much a lot of things because it's just all hands on deck when you are a citizen-run activist organization. But her main focus is really the healthcare, medical, vaccines. She pays a lot of attention to what's going on with the Washington State Board of Health and the Department of Health. So she's our watchdog there. She's amazing and really watches that stuff really closely. So she's in the chat. You can chat her up. You can, she'll ask questions too as we're going through, or she'll answer your questions. If you have a question that she can answer, she will probably answer that for you. So let's dig in right away without further ado on hey, Hannah from Vancouver, Washington. Good to see you. On the 15th, so Wednesday, there was a big announcement about a new bipartisan governor's, what is it called? The Governors Public Health Alliance, the GPHA. Now, they call it bipartisan. They're really going down this bipartisan road with this. However, all 15 governors are Democrats. The way they come into it with the bipartisan stuff is because on their advisory panel, they have some formerly elected Republicans. I think one of them was a governor, maybe state legislators as well. So they're able to call it bipartisan. So this was announced on Wednesday, October 15th. And I want to, before we really get into the details, I want to give a huge shout out to, I don't know how you say her last name, but Susan, we'll say Dupreez. That's probably not right, but let's call it Susan Dupreez. She is amazing on X. She finds all kinds of policy things, just information that citizens need to know about. She produces a lot of really important content. On social media, there's a ton of junk content, a lot of things that are not important, that serve as distractions, that everybody gets their hair on fire about. But she really shares excellent, important content. So if you are on X, please go follow her. It's at Susan_DUPRES. So be sure to follow her. She alerted me to this thing. There's so much to watch, especially I'm watching from Florida. So I watch a lot of the federal stuff and things that are going on at a kind of a national level, but still try to keep my hands in what's going on in Washington. But the Democrats are working really fast. And one of the things I want to mention on the outset here is that we have these Democrat governors, attorneys general, legislators. They are outpacing the Trump administration at a very impressive rate. And I shouldn't say impressive in a bad way. It is not good how quickly they are outworking the Trump administration. And that's not Trump's fault, right? You've got the Trump administration is like sort of sort of one body in DC, and you've got all of these different state governors and attorneys general that are working together against the Trump administration. And that's one of the things that you really don't see the Republicans do that sort of thing. When Biden was in office, you didn't see a lot of Republican governors doing some of the things that we're seeing from the Democrats on this. So they're really building an infrastructure that to me is very scary. I'm not surprised. This is one of the reasons that we left Washington. And I want to really caution people from saying things like, well, the Trump administration is going to come in and fix it. This is unconstitutional. This is going to get challenged legally. In theory, yes, all of those things would be true. However, as I said, the Trump administration is being outpaced by these Democrat governors. They don't care if things are constitutional or not. And what we've seen with the judicial system being captured by the left is that when things do go to court, they're often ruling in favor of these Democrat governors and attorneys general, which is really scary. We've seen a number of rulings that have gone against the Trump administration, for instance, with education funding. The Trump administration pulled back education funding for schools and states that were refusing to separate the girls and the boys and that were continuing with all their gender ideology. And the Trump administration got sued over that. And the court ruled that the Trump administration had to release all that funding to these schools in places like Washington and California, where they're doing all this gender ideology. So it's very discouraging to see this happening, because I think a lot of us were very hopeful that the Trump administration would come in and be able to put an end to some of this stuff by withholding the funding, that withholding the funding would really force their hand to make changes. But what we're seeing with the Democrats, and we shouldn't be surprised, is that they're really doubling down. And one of the things we see on our social media, we get comments all the time about how Trump's going to come and lock up Ferguson, and that's great fodder for social media, you guys, but it's not going to happen. Trump is not going to lock up Ferguson or Newsom or anybody else for that matter. So I really want you to take seriously what we're going to talk about today with this Governors Public Health Alliance, because it's part of a greater framework that we've been seeing. And I'm going to tie all of that together. Hi, Terry. Alex Jones and Tucker Carlson talked about this and how it relates to one world order. Yes. And we're going to talk about that as we go through this too, because there's some interesting things in this Governors Public Health Alliance, where they're going to be communicating with national organizations like the NIH, things that would be the duty of the federal government to do. Now this new alliance is going to be doing it as well as a separate entity of the federal government. So hopefully the wheels are turning and you're starting to see what they're doing here. So here is the website that they've got set up. This is all they have right now, is just this landing page, but I'm going to read to you from the press release so you kind of have an idea of what this is about. The Governors Public Health Alliance will serve as a nonpartisan coordinating hub for governors and their public health leaders. The Governors Public Health Alliance will support governors and their states in coordinating and collaborating to protect the public's health by facilitating data sharing and communication about health threat detection, emergency preparedness and response, public health guidance and policy, and deployment of experts. The Governors Public Health Alliance supports national coordination on public health at the gubernatorial level, complementing existing mechanisms and interfacing with entities like the Northeast Public Health Collaborative. So that's the New York and a few other states have their Northeast Public Health Collaborative, and the West Coast Health Alliance, which is Washington, Oregon, California, and Hawaii. The Governors Public Health Alliance will serve as a unified cross-state liaison with the global health community and will facilitate cross-state collaboration by bringing together regional and other groups to share best practices and surface common challenges, elevating national consideration for vaccine policy and regulatory solutions to keep science front and center. It's funny to me always how the Democrats like to talk about science, yet they deny the science that there are only two sexes. So that always makes me chuckle. The alliance welcomes further engagement across governors' offices and with public health associations and other relevant groups. To me, that is saying that this alliance is, this first core group of 15, it's going to grow. They want it to grow. They welcome growth. And I kind of wonder, in states like Arizona is not part of the alliance right now. However, the Arizona governor did issued an executive order giving the Secretary of Health, or whatever the title is there, the ability to write standing orders for vaccines, for the COVID-19 vaccine. And you've got Arizona is purple, right? So you've got a very radical left governor, but I don't think like down the line is very blue. And you've got a lot of conservatives that have moved to Arizona, hopefully turning it red. And Congressman Andy Biggs is running for governor in Arizona. He's a Republican, which would be very good. So strategically, from a political perspective, I wouldn't anticipate that Katie Hobbs would be joining this alliance, because that would not fare very well for her with this upcoming election. I think that could really kill it for her with people who are moderate, and with the amount of conservatives that have definitely come into the state since she's been in office. So I don't think we'll see them, but I think it's an interesting thing to kind of keep in mind as you see some of these states that are more purple and have a little bit more balance between parties in their government, and what you might see. Would you have an attorney, a governor that has, Republican legislature, would they do it? So it's going to be interesting to see what kind of, how this pans out. Is it only going to be the deep blue states, or what? But let's take a look at who the players are at this point in time. So the founding governors are Newsom and Ferguson. I think my guess is that they're kind of like the ringleaders of all of this. Healy, Hochul, Kotek, Green, Lamont, Leon Guerrero, did I say it right? From Guam. I kind of forgot about Guam, but Guam has a governor. McKee, Meyer, Moore, Murphy, Polis, Pritzker, and Stein. And the advisory personnel, this is where they get in with being able to call it bipartisan, because some of the people on the advisory committee were formerly Republicans, or were appointed by Republicans. Dr. Mandy Cohen was formerly with the CDC, Dr. Ann Zink, Dr. Raj Panjabi, Ambassador Nina Hachagian. Did I say it right? And more. So, and all of this is on their website, govactalliance.org. And you can read the press release. You can see all the players that are on it. Let's take a look at the functions of what this alliance is going to do, because this is where it gets a little bit the whole thing is scary and concerning. Not surprising, but it is very concerning. So here are their functions. They're going to do data sharing and health threat detection. They're going to have real-time surveillance pipelines. Anytime you hear the word surveillance, that should be concerning. Emergency preparedness, they will share, joint playbooks, mutual aid. They'll have toolkits that they can share amongst their departments of health and whatnot, so that they're all sharing the same information, having a cohesive messaging across the alliance. Coordinated public health guidance, vaccine policy alignment. So essentially, you'll have what we have with the CDC for America. But this will be kind of their new CDC that will push out the health guidance to all of these states that are in the alliance. So if you are in one of these 15 states, this is something to keep a really close eye on, because this is the messaging that's going to start coming out of your healthcare authorities, and things like mask mandates, which that's kind of the mask mandates is kind of the thing I think we're going to start to see first, before we're going to see any kind of vaccine mandates. But just keep that in the back of your head. I don't want anybody to get alarmed about vaccine mandates because nobody's mandated any vaccines yet. But keep that in the back of your mind because they're definitely setting up for what I'm going to say is COVID 2.0. And we're going to get to that here in just a minute. And then they will also be a liaison to the global health community, as I talked about a few minutes ago, which this is concerning because they are asserting them basically on equal footing with the federal government. The federal government represents the United States within the global community. And now we're having a separate entity within the United States that's also going to be represented. So what does this sound like to you? I'll let you answer that in the comments. I want to share with you one of the quotes that I thought was interesting. So Mindy Cohen is the former CDC director and former North Carolina Secretary for Health and Human Services. And you can see the way that these people talk. This is very much in defiance of RFK Jr. at HHS and the Trump administration at large and everything that's going on in the federal government, and really framing it for the public like that we have all these threats and the federal government isn't doing their job to protect citizens. So here, these Democrats have to step up and protect the citizens from these big medical threats because the federal government isn't doing it. And so it's so deceptive and it's so discouraging. And I worry for people who don't pay attention, who just maybe watch clips on the news, or they're still following ABC, NBC, CBS that are going to push this out like it's a good thing. So her quote, as you can read it here, is with many health threats at our doorstep, collaboration and communication between governors is essential to protect the health of families and save lives. This alliance creates the framework to support the national coordination needed to safeguard communities. So basically they're saying that the federal government is not providing the coordination that is needed. The coordination, what is that? They don't like that that the federal government is allowing citizens now. The updated recommendations for the COVID vaccines were basically personal choice, so they don't like that. They don't. I mean, we know that. We know that these Democrats want to have authority over the people. They want to force people into taking these vaccines, and if they can't force them through a mandate, they want to make the messaging sound so good and so dangerous if you don't get your COVID vaccine that you're gonna put other people in harm's way. You're gonna put yourself in harm's way. And Bob says GPHA with global ties is not United States. Yes, and Bob is I think that's Bob Runnels with Informed Choice of Washington. He is great, works with our team, and has been one of the key people in fighting against a lot of the medical mandates and the medical policies that are really not good for the citizens in Washington state. So he is a huge fighter in Washington, huge for the people there, from Informed Choice Washington. So if you're not following Informed Choice Washington, we highly recommend that you do that. We collaborate with them on a lot of these things. I'll just read you a quick quote here from Governor Bob Ferguson. We can no longer rely on the information coming out of Washington, D.C., but our states are coming together unequivocally state that science still matters. Diseases don't stop at state borders, and preparedness shouldn't either. By joining forces, we will act faster and communicate better to ensure our communities stay healthy. And basically, here's one from Massachusetts Governor Maura Healey. While Donald Trump and RFK Jr.'s turn their backs on public health, governors are stepping up to make sure our residents have the health care they need and deserve. Massachusetts is glad to join this coalition with states from across the country to build on the work we've been doing in the Northeast to safeguard public health, including access to vaccines. So this is definitely TDS on public display here, and very concerning. The biggest thing I see from here, so I want to kind of go back a few years to when I started getting involved in legislation, which was during COVID. It was 2021 is when we had the big thing with our daughter in Washington State, which connected me with former Representative Brad Clippert, which is what really got me started into Washington State legislation, and then got super involved in the 2022 legislative session. And so in Washington, in the early part of 2022 was still under emergency orders from then Governor Jay Inslee. And so a lot of the legislation was, you had some of the conservative Republicans in the legislature that were proposing policies to, for medical freedom and things like that. So we were really working on trying to get those bills a hearing. But of course, with Democrats in charge, they don't let it see the light of day. But we were really trying to oppose policies that, what I believe, are ramping up, setting up for COVID 2.0 or the next emergency, whether it's a medical emergency or what. And over the last 4 years, we have seen in Washington, and as our team has grown to looking outside of Washington State and at a national level, we have seen a lot of copy and pasting between these blue states, where they're all setting up their policy. They're all building this infrastructure for the next emergency, whatever it happens to be, whenever it happens to be. They're getting ready. And I think as we looked back on policies that were made prior to 2020 in some of these places, you could see, for instance, in Washington with the governor's emergency powers, there was a bill in the 2019 legislative session that really gave the governor of Washington State very broad authority when he declared an emergency. And I think that it received so much strong bipartisan support because nobody anticipated that COVID was coming. And so now we know better as we move forward. And so we can't let that happen again. And we see them kind of learning from COVID. We see the Democrats learning from COVID and really codifying some of these policies that they want to have in place for the next time. So what do I mean by COVID 2.0? And what am I seeing here that leads me to believe that they're setting up for the next emergency? So I put this in an article that's on our website, which you can find at conservativeladiesofamerica.com. Go click on the blog. But if you are planning, sorry, my kids are blowing up the phone. And they're adult kids, so they can wait. If you are planning for the next global health event or even a climate-related health emergency, this coalition is exactly how you do it. You'd build this coalition of governors that were loyal to your political ideology. All of these governors are on the same page with all of this stuff. They all share different policy, whether it's from gun control or health stuff. They share all, and education. Of course, we know that they're putting in all this gender crap into the schools. They share all of these policies. You see it copy paste in all of these legislatures. So you would call it nonpartisan, but fill it with partisan actors. So even the Republicans that are involved in this I don't think they're still Republicans, or they're definitely rhinos. The advisory board has some former governors. Arne Carlson is a Republican from Minnesota. Jim Doyle, he's a Democrat. Mark Racicot, R-A-C-I-C-O-T from Montana. And then Bill Weld from Massachusetts. Those are the three Republican former governors that have an R by their name. I don't know if they're still Republican or not. And as you know, in a lot of these blue states, a lot of states, even here in Florida, a lot of Republicans are totally just Democrats wearing a red coat. Former senior federal officials, Sally Yates and Larry Thompson. So you've got all these partisan folks and these radical left Democrats, but they're calling it, nonpartisan. And that's one of their favorite things to do, especially anytime a Republican crosses the line and votes for a Democrat policy. They then can call it a bipartisan bill. And it just takes one, and they love it. Like the Keep Washington Working Act in Washington that made Washington a sanctuary state for illegal immigrants. 3 Republicans crossed the line and voted yes for that in 2019. And so they love to call it the bipartisan Keep Washington Working Act. They use science as the unifying moral language, create their own data and communication pipelines. Now, they don't like the data that's coming out of HHS and the CDC with RFK Jr. at the helm. They don't like the real data. They don't like seeing the injuries that have been caused by the COVID-19 vaccine and some of the other, concerns and the deaths and all of that stuff that really is coming to light right now. They don't like that. So they want to delegitimize it. And so by forming this alliance, they're showing their followers, their people, that they're the ones to be trusted because they're following the science, where you've got this rogue federal health agency that's denying science and they're not using the right data. It's just this mastermind manipulation, and it's terrible. And then they're going to establish standing executive powers under emergency preparedness. And so we've seen this with a lot of these states having emergency executive orders so that they can create standing orders, which allows the standing orders basically, and maybe Bob will chime in here in the comments if I get it wrong, but a standing order basically allows the head person, health secretary or whatever of the state to issue a standing order. So then anyone in the state, you can get the COVID-19 vaccine without a prescription. You can go into your Walgreens and you don't have to see a doctor, and you can just say, I want the COVID vaccine, and they can give it to you. That doesn't mean they're all going to do it, but it authorizes them to do that. Or you go to the doctor and they can give you the vaccine, because I believe that the current recommendation is 65 and over, and people with the people at higher risk. So that's kind of what the standing order is. And I think there's been a lot of concern from people when they hear standing order. They think it means, mandate, and that they're two different things. When the vaccine is mandated, you will definitely know. So that's kind of what I see with as far as COVID 2.0. That's where I see this as being the setup for COVID 2.0. The other thing that we're seeing a lot of right now is not just with the healthcare, but we're seeing it with the immigration policies, and really a resistance to the federal government with the immigration enforcement. And California, I said this in yesterday's live stream. So if you haven't watched, if you want to know more about the immigration stuff, go back and watch yesterday's live stream, where it talked about the package of bills that California Governor Gavin Newsom signed on Sunday. Yes, he signed bills on Sunday when no one is paying attention to what the government is doing, because they're going to church, they're spending the day with their family, they're maybe checked out. This is a package of immigration bills that basically builds a firewall between California and the rest of the country as far as immigration enforcement. So California already was a sanctuary state. This is like sanctuary state on steroids. Washington Attorney General at the end of August, and I didn't catch this until yesterday, at the end of August, he issued a report on the labor statistics and things like that. And now he's got some recommendations going forward into the legislative session. And maybe he's going to ask for executive orders. I'm not sure. But to expand on the Washington state's sanctuary policies and really kind of come alongside California. Basically, these policies are going to obstruct federal law enforcement. It's going to, it's not just limited to immigration enforcement. We're talking about public health mandates and even education policies as well. So, and kind of they're tying a lot of this immigration stuff to schools. So, ICE officers can't go to schools. I don't know that they are. That seems a little bit far-fetched and seems like maybe a little bit of fear-mongering. But it's not, this isn't just disagreement with federal policy. This isn't just lawsuits. They are actually building a legal infrastructure to resist federal law. And it's not going to go away when Trump's no longer in office. These are laws that will be, it's very difficult to repeal a law once you've set it into law. Plus, you'd have to have all those Democrats. I mean, it's not going to happen. And so I really want to encourage those of you who are seeing this, and maybe you live in Washington and you're seeing this and you're saying, well, Trump's going to fix this. It's really unlikely that Trump is going to be able to fix this. This alliance is so strong. They're networking really well. I've got to give Democrats credit for they're very strategic in what they do. And we are always like 10 steps behind them. And so to their credit, they're doing that. And we just there's so much work for the Trump administration to do, and it has to be done quickly, and they're just not doing it quickly enough. Let's see. I wanted to, sorry guys. Trying to read some of your comments here. You guys are moving fast. I think Bob, let's see. I'm pretty sure it also, yeah, that's a good, sorry, I was looking for Bob's comment because I asked about if he wanted to chime in on Bob's got to run. Bye, Bob. See you. It was great. It was great to have you join us. The standing orders also keep the shots on insurance plan. And when I say insurance plan, if you're in a blue state like Washington, California, it would keep it on your Apple Care and all that. They're going to pay for that as well. Let's see if you guys have any question. Yep. In states like Joy says, in states like Washington and other blue state, schools are the hub of delivery system for every framework and infrastructure to ignore federal law. This is a really important point. That's a great point, Joy. They really are using the kids for this, and they're using the teachers, and the teachers have been indoctrinated through wherever their colleges and universities. They've really been indoctrinated to go along with whatever, they really are. A lot of these new teachers are activists, and they're pushing out this agenda. And you'll see it if you follow like Washington Education Association. You can just go follow their social media posts, and you will see that they are pushing out and supporting all of this framework. They also often, during the legislative session, the teachers union will testify in support for these policies. And they have, it's amazing to me, the education industrial complex has a line of people out the door to testify on all these garbage policies. And very few people, almost no one from our side of the aisle shows up. And I just want to take this opportunity to tell you guys, you don't have to be a lobbyist. You don't have to work for some kind of political organization, some think tank. You don't have to be affiliated with anyone. You can just be a citizen that is concerned about what's going on in Washington state. I can't speak for every state. I know here in Florida, we have to go to Tallahassee to testify, which makes it very difficult. I live about 8 hours from the Capitol. But in Washington, you can testify on Zoom. So there's no excuse, and you can do it. I testified on so many bills during the not this last year, but 22, 23, and 24 on Zoom. And you can just, from wherever you are, you can do it from your phone. I know my friend Eric Pratt, he'll do it from the job site. And he's outside working on the job site, and he will just pop up for his 1 or 2 minutes when they call his name on Zoom. And we need people. And in a state like Washington, one of the biggest things we always hear people say is, well, what does it matter? They're just going to do it anyway. And they're just going to pass these laws anyway. Sorry, kids keep calling. They're just going to pass these laws anyway. So what does it matter if I speak up? But there's a couple things. Number one, I don't want these bad policies to get passed without trying to make some noise. Number two, it slows down and frustrates the process when they actually the committee has to sit there and listen to you say your piece about why they shouldn't pass it. So I really encourage you, if you're one of those people that says I'm staying and I'm fighting, then please speak up, and that's how you have to fight. These This is very concerning. I really think that we are moving towards secession with a lot of these blue states. And when I saw this, I saw the West Coast Health Alliance. I've been watching these immigration policies that all kind of, copy and paste each other. But this health alliance, and I'm gonna put the landing page back up for you guys to see. This is something different. This is something bigger. This is something we can't ignore, and it's very concerning. To me, this shows a very strategic coordination and collaboration by these governors in this, these 15 governors. So this alliance represents more than 1 in 3 people. This is a third of the United States. And they've got the entire West Coast. They've got New York. They've got some really important geographic areas. And I'm not saying this to scare anybody. This is bigger than Trump. This is bigger than the Trump administration. These people have been working towards this for a while. And that's just coming from somebody who's been watching the policies pushed by a very deep blue state for the last few years. And it's easy to kind of ignore this if you are just sort of watching, things that come across your social media and you're only engaging on social media. And it's easy to say things on social media like, Trump's going to come and get, what's his name, Nick Brown or Bob Ferguson or Gavin Newsom or whoever it is. That is not going to happen. I say that with, I think, almost certainty. That's not going to happen. We haven't seen many arrests for Antifa. I think I saw Kash Patel said they arrested 20 in Texas from something that happened in July. If you know anything about Antifa, if you live in an area like Seattle or Portland where there's a large Antifa presence, you know that 20 is a drop in the bucket. So that's concerning. That's really concerning. The fact that they're not actually looking at Antifa organizations. If you look through the reports, they're looking at anti-Israel organizations. So I'm not sure why they're saying they're looking at Antifa, but the report is full of all anti-Israel. I'm not sure if they just don't know, but that's very concerning. So I want you to take this seriously, and this is one of the reasons why we left Washington, is because I saw this on the horizon. I knew that the blue states were going to get bluer and they were going to start working together, and that it was not going to be safe to do activism. I knew that I would have a target on my back with the Attorney General's office, and that it already wasn't safe for me and my family. And so, these are things that, I want you to take seriously from a person who has been down in the sewer watching this firsthand. Please take this very seriously. And I don't say that to alarm you. I'm not fear mongering, but you need to be prepared. You need to, if you're in a state like California or Washington, I don't know what firearms are still available for you guys to buy, but go buy them. You need to be armed. You need to train. You need to have a supply of ammunition. You need to have a food supply. You need to have a water supply. You need to have alternative means of communications. These are all things that will help your family be prepared. And these are things that most people don't really think about on a daily basis. And it doesn't matter where you live. It doesn't, like, we're very prepared here in Florida because we come from Washington and we know that excuse my language, but the shit's going to hit the fan, and we don't know when that's going to be. You don't know when that's going to be, but wouldn't you rather be prepared? And so we're always doing things to stay prepared. So I would encourage you to do that. I did a video several months ago about being prepared and different things that you can do to prepare your home, prepare your family. And that will help give you peace of mind. If you do live in one of these areas, that'll help give you peace of mind. But one of the reasons why we chose Florida is like, we just were like, where's going to be the place that we can hold out freedom the longest? And, you know, we thought about Idaho. Idaho for us was just a little bit too close to Washington. And so we got as far away as we could. So that's one of the reasons why we chose Florida. But, you know, I say this all the time. If you live in a red state, you are not safe. There's a huge rhino problem in every red state. Governor Ron DeSantis he's termed out. So we're going to get a new governor. Next year, there will be an election for Florida governor, and it's Byron Donalds right now. And that to me is very scary because he is a former Democrat. He has a lot of skeletons in his closet that really don't make him fit for governor. I do hope Jay Collins runs, and I hope he wins, but that remains to be seen. You know, one guy can't, like, DeSantis is kind of an anomaly, I think, in politics because he's managed to really make Florida the conservative bastion that it is, but it could easily be undone in one legislative session with a bunch of rhinos. And that's what we've got here in the Florida legislature. That's what's going on in Texas. Our friends, what are the conservative Texas people? What are they called? Grayson County conservatives. Oh, I just saw follow Grayson. She just commented that. Great minds. I'm going to put that on the screen. Yes. Grayson County conservatives. Those are our friends in Texas. They do amazing work. They're really involved in legislation, and they can tell you who the rhinos are and aren't. One of their big disappointments, as has been mine here in Florida, is the conservative candidates make all these promises as new conservatives, and then they come in and they become part of the sewer. And I now call it the sewer instead of the swamp, because I heard Representative Tim Burchett in an interview with Tucker Carlson saying that he doesn't call it the swamp because the swamp is something that God made, and it has all these, you know, cool things like frogs and toads and, you know, all the plants and things that make swamps actually kind of cool. Sewer is man-made, and it's gross and dirty and poopy. And that's what politics really is. It's unfortunate. But yes, please do go follow our friends over at Grayson County Conservatives. I think that is, I wanted to share with you guys the link for, this is where I did an article detailing this out. The article has links to all of the things that we've talked about. It goes to all of the different press releases and to the website for the new Governors Public Health Alliance. So please go check out that article, share that article with wherever you are, blue state, red state. Everybody in America needs to know that this is going on, because this is what I believe is they're really starting to ramp up the division and what I think could potentially become secession efforts. If you are not already, please do subscribe to our Substack. That is the best way to get breaking alerts and calls to action. Those, if you subscribe, it'll go directly to your email inbox, so you'll have it right away. Or if you have the app, you'll get a push notification. If you sign up for our Substack and become a paid subscriber, that's the same as being a member of Conservative Ladies of America. And it's not just for ladies. We love to have men. We welcome men. They're some of our best workers. But that's a great way. Becoming a paid subscriber is a great way that you can support the work that we're doing. We don't have deep pocket donors that keep us afloat. We are just citizens who really care a lot, and we're dependent on the donations from citizens like you to keep us going and pay for the things that, everything costs money to be able to put this out. I have to pay for the platform, the streaming platform, to be able to put this out. So all of these things do cost money, and it, we basically are volunteers. So your donations are very helpful. If you prefer, you can, if you're watching on YouTube, you can donate on YouTube right under the video. There's probably a way that you can, it's either a give thanks or give money or something like that. But you can also donate through Give, Send, Go. It's just /Conservative Ladies US. We are a 501c4 because we are involved in all this political stuff. So while we are a nonprofit, your donations are not tax deductible as they are for 501c3s, which because they're a 501c3, they can't do all this political activism that we do. So we really appreciate any support you guys can give. I think that's it. I appreciate you joining the live today. All you guys in the chat, you guys are having lively conversation. I'm not catching all of it. I'll have to come back and look at it. But I appreciate you guys joining me for this kind of impromptu Friday live stream. I hope you guys have a great weekend. Please do share this video, share this information far and wide. Let everybody know what's going on. I really feel like, we woke people up during COVID, but people really kind of settled back into complacency and aren't really paying attention to some of these big things that are going to impact all of us as Americans. So please do share this far and wide. Have a great weekend. I will be back for a live stream on Thursday. I don't know the date of that. Is that the 23rd? Anyway, I'll be back next week on Thursday at noon Pacific, 3 p.m. Eastern. I hope to see you then.